The most important thing is mothers should go for delivery in institutions where they can have these surgeries in case there are complications. Dr. Mokomba Alfred, I'm an obstetrician gynecologist at Kenyatta National Hospital. Once people understand the very good reasons why we do cesarean sections, then they'll know it's a life-saving procedure. So about 40% of our mothers undergo cesarean sections in the private wing. The main reason this occurs is because most of the mothers we see tend to be those who are high risk. They have other complications. That's why they come to Kenyatta in the first place, even for antenatal clinics. Most of the cesarean sections are emergency cesarean sections. Mothers who are in labor and for some reasons they are unable to progress and have a normal delivery, and then the cesareans are done as emergency procedures. The second type is where the cesarean section is planned because of various complications during the antenatal clinics. We plan for these particular surgeries. If the baby's position is not the way it should, the baby could be coming out with the legs, or the baby is lying across, that would be an indication for cesarean section. The other common reason is if the baby is big and the mother's the birth canal cannot accommodate the baby, then we have to do cesarean section to avoid injury to the mother and the baby. And the other common reason is for mothers who have had more than one cesarean section, then it's risky for them to undergo normal labor. So those are the ones we plan for, the planned cesarean sections. The commonest complication is bleeding, but fortunately we are able to control it. The other common disadvantage versus normal delivery is pain. The pain they might have is a bit longer after the cesarean section, but fortunately they are given medications to take care of it. And the risk of infection on the operation site, on the wound, is slightly higher. That's why we put them on antibiotics. All our mothers who come to the KPCC, that's the private wing KNH clinic, as well as the general hospital clinic, they are all seen by obstetrician gynecologists who are able to take them through the process of pregnancy, and we are able to plan based on the examination findings. We can predict this one will undergo a normal delivery, this one the risk of cesarean is high, but we do all the checks to make sure the pregnancy goes on safely until the delivery point. Also in our labor ward for private wing, all the patients are attended by obstetricians and very qualified midwives. We have equipment for continuous monitoring of these mothers when they're in labor to ensure if any complication arises, we are able to pick it out. We have a dedicated theater, private theater for our mothers in private wing to avoid any delay. So it's very, very safe. I would say as good or even better than most of even the bigger private hospitals. It has also a dedicated nursery that is specifically for mothers from the private wing. Yeah, in terms of costs, there are two packages that caters for the hospital bill, the obstetrician's bill, the pediatrician's fee, as well as the bed charges and medication. NHIF unfortunately only pays for a portion of the bed charges. It does not pay for the other cost of the delivery itself, save for only those who are under the special schemes like civil servants. That cesarean sections are life-saving procedures because not all mothers can have normal deliveries. And those who undergo through normal cesarean sections should not feel like they have not achieved. They are not women enough, because we see a lot of that. It's a mode of delivery that ensures we have a healthy baby and a healthy mother.